Hi, my name is Renee Van Staveren. I work with hundreds of local Medicare agents across the nation, and I lead Medicare education at Connie Health. In this beginner's video, we'll answer the question, what is Medicare Part A? And we'll review Medicare Part A's coverage, costs, and how to enroll. Stay tuned. Let's start at the beginning. What is Medicare Part A? Medicare Part A is part of the United States federal health insurance program, also called Original Medicare. Medicare Part A is often referred to as hospital insurance. You can be eligible for Medicare Part A in three ways. First, you could be 65 years or older. Second, you could be under 65 but have an approved Social Security disability. Or the third, which is that you have end-stage renal disease, ESRD, or ALS. Now, one of the primary questions we get is, what does Medicare Part A cover? Medicare Part A is your federal hospital insurance. Medicare Part A covers hospital services when they are medically necessary and delivered by a Medicare assigned provider in a Medicare approved facility. That's very big convoluted language, but it basically means that before you go to a hospital setting and you're using your Part A Medicare insurance, you need to make sure that the provider you're going to is someone who accepts Medicare and that the facility or hospital that you're going to also is a Medicare approved facility. If you overlook that step, you could end up paying out of pocket for all of the services you receive from that provider or in that hospital or medical facility. Your Medicare Part A hospital insurance will cover you in the following settings: inpatient care in a hospital, mental health inpatient care, skilled nursing facility care, short-term nursing home care, hospice care, and home health care. Now let's move on and review what the Medicare Part A costs are. There is a premium, potentially, and out-of-pocket costs. For the majority of people, Medicare Part A should be premium-free. However, you have to be eligible for the premium-free Medicare Part A. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below. And watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. You're eligible for premium-free Medicare Part A if you meet one of the following four criteria. Number one, you receive retirement benefits from the Social Security Administration or the Railroad Retirement Board. Number two, you're eligible for Social Security or railroad benefits, but you have not filed for them yet. Number three, you or your spouse had Medicare-covered government employment. Or number four, you or your spouse earned 40 credits or worked and paid into the Federal Insurance Contributions Act, FICA taxes for at least 10 years. If you meet one of those four requirements, your Medicare Part A will be premium-free. Now, if you don't meet those requirements, you will likely pay a premium. The good news is that you can still purchase Medicare Part A hospital insurance. Original Medicare decides the cost by determining how many quarters you worked. If you worked under 30 quarters, it'll be one cost. If you worked between 30 to 39 quarters, it'll be a different cost. If you worked 40 and above, it should be premium free. If you don't qualify for premium free Medicare Part A, I did link an article in the description below, and you should check that out. It includes the costs of Medicare Part A if you worked for fewer than 30 quarters or between 30 to 39 quarters. This is really important. You don't want any Medicare Part A late enrollment penalties. If you don't qualify for premium-free Medicare Part A and you choose not to enroll when you first become eligible for Medicare, you could face a 10% late enrollment penalty. And you'd also need to pay this increased premium for twice the number of years that you didn't sign up. For example, suppose you were eligible for Medicare Part A, but it wasn't premium free, and you didn't know about this late enrollment penalty, and you didn't know that the delay could have these ramifications, and you waited 5 years. So you're 70 years old now, and you realize, oops, I didn't enroll in Medicare Part A and now I need to do it. Well, if your premium was $100, it'll now be $110. And because you delayed for 5 years, you'd now have to pay that extra $10 a month penalty for 10 years. So if you add that all up, it's an extra $120 a year, and over those 10 years, an extra $1,200. So you really want to make sure you sign up, whether or not you have to pay a premium for Medicare Part A in order to avoid these extra fees and these penalties. Now, what about the deductible and coinsurance or copays? Yes, Medicare Part A has those as well. There's a Medicare Part A deductible that changes yearly. And when you are admitted to the hospital or need some kind of inpatient care, you will need to pay the Part A deductible plus any coinsurance. The coinsurance costs vary depending on the services that you receive and also how long you're either in the hospital or have inpatient care. If you're curious about this year's Medicare Part A deductible and coinsurance costs, there's an article linked in the description below. Now that you know the eligibility, coverage, and costs of Medicare Part A, how do you sign up for Medicare Part A? Now, there's two kind of camps of people. There's a group that will automatically be enrolled in Part A, and lucky them. And there's a group that will need to enroll in Medicare Part A. Let me review why that might happen. When you're already receiving Social Security retirement benefits, you'll automatically be enrolled in Medicare Part A and B starting the first day of the month you turn 65. So if you were turning 65 August 15th, your Medicare A and B would start on August 1st. Similarly, if you've been receiving disability benefits from the Social Security Administration for 24 months, you'll also be automatically enrolled in Medicare Part A and B. And if you have end-stage renal disease or ALS, you'll also be automatically enrolled in Medicare. If you don't fall into one of those camps where you're receiving Social Security retirement benefits or disability benefits, then you'll need to enroll in Medicare Part A yourself. This could apply to someone who maybe is 65 years old, but is still working. If you're 65 and you're continuing to work and not taking Social Security retirement benefits, we recommend that you speak with your employer and the Social Security Administration to determine whether or not you need to enroll in Medicare Part A. Now remember, if you don't qualify for the premium-free Medicare Part A, then you do want to avoid those late enrollment penalties. Remember, it could be 10% and twice as long as you waited to enroll. As you're considering Medicare Part A enrollment, a key enrollment period to consider is your initial enrollment period. It starts 3 months before you turn 65, includes the month of your 65th birthday, and the 3 months following your 65th birthday. So a total of 7 months. If you're approaching your 65th birthday or it's recently passed, we highly recommend that you reach out to the Social Security Administration and your employer to see what the next best steps are for you. If you need to take action and enroll in Medicare Part A, there are 4 ways to do that. Connie Health wrote an article that shares this year's coverage, costs, enrollment details that all make enrolling super easy. To read about Medicare Part A, visit the link in the description below. In this video, we've covered what is Medicare Part A, Medicare Part A's coverage, costs, and how to enroll. If you like this video, hit the like button. And if you'd like to see videos just like this, subscribe to our channel. We hope that you've enjoyed this video. For more Medicare for Beginners videos, click the video links in the description below. Till next time.